You're watching the Health Channel, all health, all the time. I am Cynthia Demas. Let me ask you a question, or a few. Do you have trouble falling asleep? Do you take cat naps during the day? Do you toss and turn and wake up throughout the night? Have you been told you snore? If you answered yes to two or more of those questions, you may have a sleep disorder. And that's okay, because we're going to give you some great advice on how to deal with it. We are here with sleep expert Dr. Timothy Grant, Medical Director of Baptist Sleep Center at Baptist Outpatient Services. Thank you so much for joining us here today. Wide-eyed and bushy-tailed, aren't you?
I'm happy to be here, Cynthia.
We're happy to have you here. Let's start off the bat. Why is sleep so important for our health?
Well, it turns out that that's a question that everybody asks. People think that, oh my gosh, you just go to sleep, your brain quiets down, and you wake up in the morning and that's all that happens. But really what happens is your brain is often more active at night than it is during the daytime.
Oh.
You use more sugar at night in your brain, you use more oxygen at different parts of the night in your brain than you would when you're awake. We now know that there are parts of the night that you actually clean out the waste products from your brain that you can't do during the daytime. So you have to be able to sleep to be able to rejuvenate your brain, to be able to consolidate memories, to consolidate your energy, to feel refreshed and rejuvenated for the next day. What's fascinating is you saw the picture of the puppy and the kitty at the beginning. You know, mammals all have these stages of sleep, but there's certain mammals, Cynthia, that do things differently than we can do.
So cute.
For instance, when you look at your dog or cat, you can see they're going through different stages of sleep. They can dream, they can toss around. There are actually dolphins that can sleep with one side of their brain at one time and then swim and switch to the other side of the brain being asleep. So they can switch different parts of their brain being asleep at different times. And researchers are trying to figure out how this can apply to us and how humans may be able to benefit from this different kind of research. So sleep is very, very important.
Wow, that's amazing. So Dr. Grant is a neurologist, but your specialty is in sleep medicine. How did that come about?
So I was one of those doctors who loved just about everything I ever took. You know, you take rotations when you're in training, and I would come home and I would say, oh, I'm going to be an obstetrician. Oh, I'm going to be a surgeon. Oh, I'm going to be this or that. And my last rotation was a neurologist in neurology, and I realized that that interacted with every different specialty because the nervous system has to do with every different specialty. And then several years ago, I took a sleep course in Stanford, California. That's one of the meccas of sleep medicine. And I just fell in love with it. And I just love being specialized, ultra specialized, that I can help doctors and I can help patients. And I realized that sleep medicine is one of those things that you can truly, truly, truly help patients and improve the quality of their lives.
I think that you're in the majority. I think a lot of people are obsessed with sleep and learning how to sleep better. I definitely think that. What contributes to our lack of sleep?
Well, you can imagine, you know, even us. I'll give my perfect example. I had a nephew ask me recently, he works for IBM, and he said, hey, do you think that all this technology is a good thing or a bad thing? And I said, well, it's actually both. And the example is, last night I was working till 10:30, working on patient studies and scoring things through the computer. I would never have done that many years ago when I didn't have computer access to charts and to the laboratory. So that's not a good thing. That's one of the things I'm going to tell you later in our discussion. That's not a healthy thing to do, to be up so late and working and to have your brain so active before you can quiet down and go to sleep. So our active work schedules, the fact that we work so long, the fact that we're exposed to light exposure from TVs, from computer screens, from telephones. We even know now that the alerting message on your telephone, just the light from your telephone, can interrupt your sleep at night. And the fact that we work harder during the week and we try to make up for that on the weekends, that wreaks havoc on your sleep system as well. So there are all of these different things that are different than they were years ago. The innovation of shift work many, many decades ago, and the fact that so many of us work shift work, Cynthia, is a terrible thing. Shift work is a risk factor for almost every single illness as related to sleep. And so there are many different things in our modern world, including traveling and jet lag and working so hard. So all those different things can contribute to poor sleep.
What do you mean by shift work?
So shift work is typically when somebody's not working at the typical time when the normal body would want to be asleep.
Okay.
So for instance, the thing that makes us go to sleep at night is you're awake during the day, and you've been awake for so long that you get tired, you want to go to sleep. But the other thing is when the sun goes down, there's a natural phenomenon that your brain makes melatonin, this natural substance from deep inside of your brain that kind of hops over to another part of your brain and tells it to quiet down and go to sleep. But if there's light exposure, when you go to work and there's lights on in the middle of the night and somebody's working the 11 to 7 shift at night, they're supposed to be asleep. They're not supposed to be awake. So you're fighting this natural instinct to want to be asleep, and it's hard for your body to adapt to that. So shift work is typically not that 7 to 3 or 9 to 3 or 9 to 5 work hour during the daytime. It's working late in the afternoon, or typically the worst is working late at night, that 11 to 7 shift.
And that wreaks havoc on you.
Works havoc on your
And there's
body.
do you ever get used to it?
No, you don't. You know, there are some people that are better at it.
Yeah.
You know, we now know this is an interesting phenomenon. You know, when I was in college, I used to play piano at night in bars.
I like
And it
that.
sounds kind of silly, but I would go and I'd play piano until the middle of the night and then go to class early in the morning. And I thought I was a night owl, but I'm not a night owl. I didn't function that well, and it kind of caught up with me, and I realized that as I got older, I'm really kind of a lark. I do better in the morning. I do better with my time. And it turns out we now know historically, Cynthia, that genetically people can be more predisposed to be a night owl or be a lark.
Okay.
And people who are night owls, you can imagine, they do better with shift work than somebody who's predisposed to feel better in the morning. But as it turns out, after you do many, many years, you can get a little bit used to it, but it still is a risk factor for all different sorts of illnesses.
All right, so hopefully you're just playing the piano at brunch now instead of
I play
the
for
wee
my
hours.
my wife and my grandchildren.
Okay.
They're the best audience for me. So.
and during the daylight hours. What are the stages of sleep?
So that's a great question too. You know, people think, as I said, if you were sitting around now, 4th of July is coming up, and you sat around with your family and you said, hey, what do you think happens when you go to sleep? And they say, well, you know, you kind of shut your eyes and you become unresponsive and you wake up. But that's not really what happens. You go through different stages of sleep. You go through light sleep, and then a little bit of deeper sleep, and then what we call REM sleep, rapid eye movement sleep. And that's when you dream. And these cycles happen about every 90 minutes during the night. And you cycle in and out of those different things, and you need to cycle into that to have the refreshing sleep and the rejuvenating sleep, and for these different things to happen to help you feel better in the morning.
Okay. And there are some common sleep disorders here, starting with insomnia.
Yeah.
How common is that? You hear about insomnia, but do you really know? Well, you know a lot of people with insomnia.
Well, that's what I say. So I say it very commonly in my practice, obviously, because I'm a sleep specialist. But
Right.
if you just looked at the general population, between 9 and 10% of the population has what we call chronic insomnia. That means that it's lasting for more than a month. It's been going on for a long, long time. But it's very common that if you talk to 100 people on the sidewalk, 50% of them would probably say at some time in the last year they had problems with their sleep. So if you look at this little graphic here, this chart, these are the common things we see in my practice, in a sleep specialist practice. We see insomnia. We'll talk about that a little bit later. We talk about sleep apnea, trouble breathing.
We're going to really get into that after the break.
Periodic limb movements. We'll talk about that, and restless leg syndrome. REM sleep behavior disorder. So what that means is you're actually doing things at night that you don't really want to be doing. And instead of dreaming a dream, you actually act out the dream and do something physical that you really don't want to do. And then narcolepsy and hypersomnolence refers to being excessively sleepy during the daytime. So the things that a sleep specialist does is typically what we do is we deal with trouble sleeping at night or being too sleepy during the daytime. So we can see people who say, gee, I can't sleep at night, or I'm gasping or choking, or I can see a pilot, an airline pilot, who says, listen, I've got to see you because I've got to prove that I'm not sleepy during the daytime. Or somebody who's a metro driver or a bus driver and being able to stay awake and alert during the day so they don't have an accident. So we see people with both different phenomena, nighttime and daytime sleep issues.
Wow. So we've gone over the different types of sleep disorders, but how do you know if you have any sleep problems? Let's take a look at Dr. Grant's questions to ask your bed partner. Here we go.
So these are simple questions. This is something I came up with on my own for my patients. Instead of having a long list of endless questions, these are simple things. So do you snore or stop breathing when you're sleeping? And we'll talk about that, how important that is. Do you have restless legs? Are your legs jerking around and keeping you from falling asleep or waking you up in the middle of the night? Do you act out your dreams? Are you just dreaming a dream, or do you actually do something physically that you wouldn't want to do? Do you exhibit violent behavior? And we'll talk about that, things that can be very, very worrisome and dangerous at night, but are very, very treatable. And excessive daytime sleepiness, being too sleepy during the daytime. So if you have any of these things, that's the reason why you should see a sleep specialist.
All right, and there are some diseases that are associated with sleep disorders.
Absolutely. So we now know that here's another slide that's very, very relevant. We now know that anything that interrupts or what we call fragments sleep can cause and predispose to different illnesses. And there's 5 major ones that are very, very serious. That's heart disease, cardiovascular disease, or irregular heart rhythms. There's hypertension, which is high blood pressure. There's cerebrovascular disease, which is stroke, diabetes, and depression. And now we know that sleep issues can be a risk factor for every type of cancer, as well as eye problems like glaucoma.
And how does sleep affect your heart health? I know we just touched on that a little bit.
So one of the things that we said rejuvenates you, makes you feel better during the daytime, is getting a good night's sleep. But if something is interrupting your sleep, and in another segment we're going to talk about disruptions of sleep and how your nervous system can actually jolt you from one stage of sleep to another stage of sleep. And when those things happen, it can put a tremendous stress on your heart and what we call your cardiovascular system. So it can not only predispose you to heart attack, but it can jerk you into an irregular heart rhythm like atrial fibrillation. And all the big literature now in the last several years, it says if you have an irregular heart rhythm like atrial fibrillation, it's very, very important to make sure that you don't have a sleep problem, because if you treat the sleep problem, you're much less likely to have persistent irregular heartbeat, much less likely to have a heart attack or a stroke.